So here, further speaking about the concept of contact is control, control is safety. Patients in seated, we've already done videos on seated. What we want to talk about is essentially what can be considered a popular or a vogue or a quote-unquote sexy posture in osteopathic manual therapy or other manual therapeutics. And some people will call it a stork stance. Okay, so I, as a practitioner, have one foot on the floor and one foot on the table. And you'll see a lot of people say that it's very useful for many things. Okay, so what we do with a patient in seated, we lift the patient's arm up, come underneath, and we brace their arm on our thigh. Now what this does, that a lot of people don't talk about, is it forces your abdomen and your thorax to be in contact with the patient. So now I have lots of control options. So you see I can drift the patient out here. Okay, so the shoulder can come up, I can work on the neck, right? Now what ends up happening here is this essentially ends up looking like a grappling pose, like I'm about to submit my patient, which is not obviously the case. That's not something that we do in osteopathic manual therapy or manual therapeutics in general. But what this does is it allows us to side bend to the side opposite of the leg. Okay? So we can exhale ribs on this side. We can inhale ribs on this side. So if we kind of sneak into their armpit, you can see my hand sneak through. I sneak in here, I can palpate these. I can push down on this shoulder, I can lift those ribs. I can work through the neck, right? I can rotate my patient to a degree. I can work triplanar, as many osteopathic practitioners like to say. Many osteopathic practitioners will say, what's the difference between a chiropractic therapist and an osteopathic manual therapist, or a chiropractor, a doctor of chiropractic, is that they work biplanar, we work triplanar. I don't think that's actually an accurate statement. Osteopathic manual practitioners will work on the planes that are required. If one plane is required, you work on that. If two planes are required, you work on that. If three planes are required, you work on that. And I think that's true for a chiropractor as well. I don't think that's unique to any profession. But what you get here, okay, by accident, many people think this is vogue, sexy, in style, fancy, is you get a practitioner that's working very hard. So say I'm a practitioner that has problems with my hips, this is not useful. Okay? So we get somebody doing this, I can side bend the patient. Now, here. So you see, if I'm working on the neck, I frame his head, I come in through the shoulder, I can do all kinds of stuff. So all of a sudden people are like, oh, a treatment of this nature becomes very integrated, or I have many things moving at a time. The reason you can do that in this case is because you can really stack, you can pay attention to all kinds of tension in the patient, especially if they're able to relax. And you can really kind of tune into everything. You can get them to a position of ease or a position of bind with a lot of ease. We can achieve something like that by simply contacting, wrapping the patient up. If I want to work on the vertebrae, do something like that. If I want to work on the ribs, specifically, come around. Again, lots of contact with my abdomen and my thorax. Come in here, and really start to work on the ribs. So I've broken that up into essentially two separate things. So, vertebral column, okay, mostly in the coronal plane, but I can engage the transverse plane if I need to. If I need to engage the sagittal plane, I can basically kind of hip check into my patient. This is all predicated on lots of body contact. I can do all those things. And they are easier as individual pieces on me as a practitioner. If I'm a practitioner with good hips, with good balance, then I can go ahead and I can have a leg up. And I can make it a very integrated treatment, which is useful from time to time. Some people do it just because they think it's nice or fancy. I would suggest against it in many cases because if it's a preferred method, you as a practitioner will get quite tired. Now, that concept of using the thigh essentially as a tripod or as a point of contact can be done in other positions. So if we have you lay on your back, what you will see some practitioners do, bend both knees, lift your feet up, as you'll see them do something along these lines. So what this does, okay, this takes some of the weight of holding the legs off of me as a practitioner. I can go ahead. Right now, this patient's knees automatically spread out, so I have a problem with this posture. The problem that I have with this posture is I can't control the patient appropriately. So I would have to change to something like this. Keep his knees together. I can work in many ways. Okay? Now I can work quite effectively through the lumbar column, but the problem that I run into is that if I want to go higher, if I want to create more flexion, whatever I want to create based on where I put my foot, I actually need to move my foot up, and that becomes somewhat clumsy. Okay? But the same concept of more contact with the patient, I utilize my thigh as essentially another hand, another way to control this patient. I can get interesting things to happen, but it can become quite cumbersome. So while it may look very nice in pictures, it can become quite cumbersome. So I can consider other methodologies through which to do the same thing. The benefit of something like that is, without knowing it, whether this has been said to you, this concept has been discussed with you or explained to you, is that by using the thigh as a contact point, as a stabilizing point, is it automatically brings more body contact in the picture, because you have to get closer to the patient by sneaking your leg under their thighs. You have to get closer to them for more control, so that you can actually kind of maintain that posture. And what automatically happens is you have more contact with them, you have more opportunity for multi-point discrimination. The thing we want to consider is the amount of work that happens for the practitioner. You will see in certain points, or you will hear, or you'll read, even in Dr. Still's writings, about things like more contact. So when talking about setting a hip, Dr. Still will talk about bringing the thigh up, right? Taking this hand, and you won't see it, but essentially I'd come to the greater trochanter. So I wrap around the greater trochanter. Dr. Still essentially says, come out, put your chin on. He talks about specifically putting your chin on, coming out, and dropping. So that's something that Dr. Still talks about. He speaks about the chin and creating compression, leaning through. But what you see here, again, contact, wrapping around, more contact, contact, control. So in Dr. Still's description of this, it's again about contact. You'll hear Dr. Still speak about using his leg, essentially in a patient's armpit. Okay, come up here in the armpit. That can help open the axilla, right? You'll see pictures of this on social media for varying things. You'll see people using their feet. There are videos that I've seen of people treating with manual methods elephants and using their feet on the elephant. It's a very interesting thing to see. It looks pretty cool. How else are you going to treat an elephant except use a lot of force? The concept being having more opportunity to contact the patient, to control the patient. So if I want to use a lot of force, or if I want to know what's going on, I can use a hand on the arm, hand to palpate, knee to work. Okay? We're talking about, in varying descriptions, in varying locations, the concept of more contact for more control. That's why you will see throughout the history of the profession people utilizing things like straps, utilizing things like wedges, sandbags, varying things to help them get the job done. Some people have problems with that, some people appreciate it, some people use it, some people don't. It all comes down to more contact, more freedom for the operator or for the practitioner to utilize their bodies to sense what's going on, to pay attention to what's going on. The descriptions may tell other stories, but again, we come back to broad contact again and again. Broad contact for control, broad contact for more multi-point discrimination. That multi-point discrimination allows you to understand more accurately where the restrictions may be. So again, we just come back to this concept over and over again. We sew them together under the general umbrella of broad contact.